Is this a good year for you to make a switch from a Medicare Supplement plan to a Medicare Advantage plan? That's what we want to discuss in our video today. If you've been on a Medicare Supplement plan for many years, you know that the premiums continue to increase each year. Unfortunately, all Medicare Supplement plans increase in premium from all insurance carriers each year as you get older. That's just a fact of life. The longer you've been on the Medicare Supplement plan, the higher your monthly premium. And so maybe it makes sense to take a look at leaving the Medicare Supplement plan and going on one of the lower cost Medicare Advantage plans. In addition to your monthly premium increasing for your Medicare Supplement each year, we are anticipating significant premium increases for Medicare Part D plans next year. I think in general that the lowest cost Medicare prescription drug plan is going to be $35 or higher for next year. And so you may be on one of the zero premium plans this year or a low $5 monthly premium plan and annoyed by the fact that now you have to pay $35 or more for your Medicare Part D plan. And so because of the increasing price in your monthly premium for your Medicare Supplement, and the fact that your Medicare Part D plan is going to be increasing for 2025, maybe a zero premium Medicare Advantage plan makes sense for you. In general, we have been seeing more and more people enrolling into Medicare Advantage plans. When we looked at our numbers for last year, we enrolled 1,560 people into new Medicare plans for last year. And we presented Medicare Supplement plans and Medicare Advantage plans. 71% of the people that we met with chose the Medicare Advantage plans. So there's definitely an upward trend of people enrolling into Medicare Advantage plans. For the first time in this country, in 2023, 51% of people that have Medicare plans are enrolled in Medicare Advantage plans. So it's the first time in the history of Medicare where a higher percentage of people are enrolled in Medicare Advantage plans than not. One of the reasons that there are lots of people enrolled in Medicare Advantage plans and that we're seeing more and more people enroll in Advantage plans is a lot of the extra stuff that's built into the Medicare Advantage plans. Most, if not all, Medicare Advantage plans include things like dental benefits, routine eye exams, eyeglass hardware, hearing aids and hearing coverage. The over-the-counter benefits are available in many plans where they'll give you money on a debit card to pay for things that you're using every day from the pharmacy, like toothbrushes, toothpaste, vitamins, supplements, pain relievers. Lots of Medicare Advantage plans have these extras built into them. And so we hear from our Medicare Supplement people that are frustrated saying things like, why am I paying all this money every month for my Medicare Supplement and it keeps going up every year and I'm not getting all of this extra stuff that my friends and family are telling me they have, and they're getting more for their money and not having to pay a premium for it. And so if you're frustrated by your premiums and frankly frustrated by the fact that you're not getting these extra benefits, this would be a good time to take a look at a Medicare Advantage plan. Medicare Advantage plans, unlike your Medicare Supplement, however, do have networks. We are blessed in this area that most of the Medicare Advantage plans include all of the major hospital systems in their networks and the doctors employed by those hospital systems. So if you're thinking about a Medicare Advantage plan, we'll ask you about your doctors and hospitals, we'll do an analysis, and we'll make a recommendation of a plan that includes the providers that you want to see. We would never want to make a recommendation to you for a Medicare Advantage plan that did not include the doctors that you like to see. So that's the first part of the analysis, is to take a look at your doctors, take a look at your prescriptions, take a look at who your dentist is, and try to find a plan that covers the providers that you continue to see or want to continue to see. Medicare Advantage plans do have copays, where you may not have copays with your Medicare Supplement, but the copays on Medicare plans are very reasonable. It's not uncommon for a plan to have a $5 copay for a primary doctor or a $10 copay for a primary doctor. Maybe it's a $30 or $35 copay for a specialist. But with the copays that you pay, the plans do have what's called a maximum out-of-pocket limit, which is a limit on the amount of copays that you would have to pay in a year. It's not a deductible, it works different than that. Most of the plans have a maximum out-of-pocket limit of a number between about $3,500 and $4,500 per year. And so if you had a really bad year with your Medicare Advantage plan and you paid lots of Medicare copays for things that you do, you would be protected by the maximum out-of-pocket limit. So you could look at what you would be saving in your monthly premiums by not having to pay for a Medicare Supplement every month and not having to pay for a Medicare Part D plan. And so that would be your savings. And with that savings, you would use the savings to pay the copays, but you would be limited on the amount of copays that you would have to pay in the year, and that's based on the plan. And that's part of what we would discuss when we meet with you to talk about Medicare Advantage plans. So if you have been hearing from family and friends that are bragging about all the extra benefits they're getting with their Medicare Advantage plans, and you're frustrated by your Medicare Supplement as it continues to increase in price each year, and you're now frustrated by your Medicare Part D coverage that maybe is going to cost you $35 or more per month, this would be a good time to take a look at a Medicare Advantage plan. We would need to do that between October 15th and December 7th of each year. That's the Medicare annual enrollment period. And your plan would become effective the 1st of January. But if you're thinking that way, give us a call, send us an email, reach out to us. We want to gather the data and then do our analysis, sit down with you and make a plan recommendation and help you decide if that may be the way for you to go. I do have another video that discusses why there are more and more people enrolling in Medicare Advantage plans. It's a little bit of a longer video, but it goes into more detail that you may be interested, and we'll put a link on this video if you'd like to see that. Thanks for taking the time to view my video.